Welcome to the I-29 Moo U Dairy Podcast. The I-29 Moo University is a consortium of the land-grant universities located in Minnesota, Iowa, South Dakota, and Nebraska. This podcast covers timely news, information, and research for today's dairy industry. Hi, my name is Jim Salfer with the University of Minnesota Extension. I'm joined by my co-host and colleague, Fred Hall. He's with Iowa State University. Welcome, Fred.
Thank you for putting up with me again.
On today's podcast, we're really excited to be joined by Dr. Adrian Barragan. I'm sure I murdered his name. He is from Argentina, so I can't speak Spanish very well. He's an extension veterinarian, actually, on Penn State University. And he got his DVM in Argentina, and then he practiced on some feedlots in Argentina. He then came to the U.S., worked at a veterinarian on a large organic dairy farm, and then he ended up with his master's and his PhD at Ohio State University. And Dr. Barragan's doing a lot of research focusing on better understanding inflammation, kind of before and after calving and how it affects performance. So that's really our topic for the day today. So Dr. Barragan, you can do a little better introduction if you want and talk a little bit about your research or some of the results that you found.
First of all, thanks, James and Fred, for the invitation. I'm really happy to be here. Your pronunciation of the name was perfect. That will be the English translation, and it's great. One thing that I got to point out, though, that you said Ohio State University, you should have said the Ohio State University.
True. Is it true that it's supposed to be the Penn State University, too?
Well, no, because Penn State, we have University of Pennsylvania, which is UPenn, and we have Penn State University. So they're more, different. So the D is not that big of a deal like Ohio State.
Okay, yeah.
At least that's
Ohio
my
State.
understanding.
Yeah.
Anyhow, well, thanks again for the invitation. And yeah, I just have been at Pennsylvania for about 7 years now, working on sort of a little bit following up with my PhD work on inflammation and transition cow, and also the uterine diseases. That sort of was the topic of the webinar that we did with Fred a couple of weeks ago. And a little bit on that, what we covered in the webinar was this sort of controversial and sort of debatable area of what is metritis, right? One of the most prevalent and common uterine diseases in cattle. Actually, overall, is usually number third or second on the rank of prevalence of the other disease, right? Because we usually will have mastitis as number one, and then either lameness or metritis at number two or number three. But one thing that has been an area of controversy is the definition, right? What is actually metritis? And there are so many different definitions used in peer-review published work. That's one thing that I focus on the webinar, or the first area that we cover in the webinar about, can we just come into agreement that this is metritis and this is not? And a little bit of that, James, I just mentioned a study from, I believe it was California, the UC Davis group from Noelia de Silva and others, where they actually come out with a literature review, sort of a meta-analysis of all the different studies that have look at metritis and what definition they have used, and they come out with a few of the main factors that they use to define metritis, and it was sort of a consensus of the more features used was the odor, used as a fetid or foul smelling odor. They use the color as brownish, red brownish color. The consistency is the most utilized was watery. And then that was sort of like about the vaginal discharge features, right? And another aspect that was utilized to assess or to define metritis was presence or not of systemic signs such as fever, anorexia, dropping milk, and so on. So with that being said, I sort of tied that to a manuscript which is published in the Veterinary Journal in February, I believe, March or February of this year, where we look into the different inflammatory, metabolic, and behavioral patterns of cows with different vaginal discharge score. And what we found there is basically with this 5-scale score, utilized previous literature, or at least the most common one used of those scoring system. And we use 1, 2, 3 as normal, which is basically is either clear, dense, or dense with some flake of pus of or less than 50% pus. And then the 4 and the 5 were those that is 4 would be watery, brown, red brownish, without smell, and the 5 would be the watery brown, red brownish with smell. So that was the main difference between 4 and 5, right? Because I had this conversation with colleagues. Say it doesn't smell. If it does not smell, it's not metritis. And I always argue with people, with my colleagues, because say that discharge is not normal. It cannot be water. It cannot be brownish, darkish. It was like, so therefore we did a study and we found something really interesting. When it comes to the inflammatory patterns, we found that 1 to 3, those scores were really low. They didn't have any inflammatory markers increase in their blood. The 4s were much higher than the 1s and 2, 3, and the 5 were even higher. So it was like a scale of severity, like being 1 to 3 healthy, 4 being sick or milder sick, and 5 being severely sick. The same we saw with body condition score and rumination and milk production. So even milk production was decreased on those 4s. So if you are going to tell me that a healthy cow will have drop in milk, now it's like, I will argue with that, because those animals shouldn't have drop in milk or drop in rumination time. So anyhow, that study was provided light on that sort of blurry area where we didn't know if, the smell, right? The smell, that's the smell matter, right? And, after doing the study, I will say it does matter just for the severity of the disease. But with or without the smell, that animal still is sick, right? The animal still has metritis. It's just more severe if it's smelling to fetid or foul smell. That makes sense?
Yeah, so what's the difference between a 3 and a 4? It sounds like there's kind of a cut point there. So I'm out,
Yeah.
somebody's listening, I'm out in the barn, I'm looking at these cows and I'm trying to decide what kind of
Mhm.
is that cutoff where you would walk in a barn, you'd be a consulting veterinarian to walk in, I think she's a 3. I know how to locomotion score cows, but I'm not sure I know how to try to score cows.
Yeah, I mean, just to go through the whole scoring system, the one will be the easy one. It's just clear and dense, and that beautiful discharge that you would like to see the soonest possible after calving. Right? That is sort of the discharge you will see in a cow that is in heat, right? That really dense and clear discharge. The 2 will be a clear dense discharge with flake of pus, right? And the 3 will be a dense discharge with around 50% or more of pus, right? But it's dense, and it has that purulent discharge sort of. And then the 4, the main difference between the 4 and a 3 is that 4 is watery. It's not dense anymore. It's watery, and it's red brownish. So it's really that, it's like water, like stained water, right? And one sort of side note on this, because we did a study along with this, we were testing 2 hypotheses when we were assessing the second part of this study that I mentioned about classification. We did a second section of treatment. So we assessed 2 different treatment, and one of the treatment was with intrauterine dextrose. So we tried doing the dextrose on the third, on the score 3, and actually it got that discharge longer on time, and the cows that we did not treat, they self-cure. They just did totally fine, no any alterations on the markers that we assessed or anything like that. So we sort of discontinued the study because the treatment was actually making it worse, right? So on those lines, and based on this research and many other research that we have done with metritis and metritis treatment, I would recommend do not touch those 3. Those 3 are fine. They, of course, if there is pus, right, or purulent discharge, there is some infection going on, is totally manageable by the cow. I
So
think
as
that's
long
sometimes.
as the discharge is kind of a thicker discharge, not all pussy and runny, but
Right.
if some flecks of pus, because I think that's a question farmers struggle with a little bit, is
Mhm.
any pus in a discharge, is that okay? Should I intervene? But you would argue the cow looks good, there can be some flakes of pus in there, and it shouldn't, that those cows will self-cure on their own.
Correct. That is one big area that is being researched now, that even cows with a more severe metritis score, like a 4 or 5, about 40% of them will self-cure. So now a lot of research is being done by many colleagues in the nation. They're looking into how can we identify a cow that's going to self-cure and a cow that needs treatment, intervention, right? But without that, because that might be coming in, I will say 5 years, we'll know more on that. I know there is some really smart people working in that area. But as of now, I would recommend do not touching those three scores, or the ones that have flake of pus. Those animals will do fine. They don't need any intervention. And I think that the industry is going towards those lines. That we were so high interventionists for so many years, checking cows daily, temping cows daily, doing so much. And now we're understanding we have to back off a little bit. We're understanding that by doing that much, we actually adding stress to those animals. We're going to be even adding inflammation as all of those metabolites are related. And we might be causing more harm than good, especially to healthy animals, right? That they don't need any checkup. Right. So with that being said, that will be my main recommendations. 1 to 3, leave those animals alone. The ones that are watery, red, brownish, with or without smell, might need some interventions.
Now, as I was listening to the webinar, you really seem to make the cut if there's an odor there. Mm-hmm. Is that still correct?
Well, that is most of the literature published. They use the odor as a determinant factor. To be, if it has the odor, it's metritis. If it doesn't have an odor, it's not metritis. Now with this work that we published earlier this year, I started questioning that. I was trying to say, I think that the odor is not the determinant factor. If the discharge is watery and brownish, red brownish, with or without odor is abnormal. That means that animal is sick. Then that means that animal needs something. It's just the odor will determine the severity, Fred. So basically, no odor is a little milder. And based on the markers that we assess, the inflammation, we measure also VHP as a metabolic stress marker, body condition score, and so on. So the odor just determine or tell us that it's a more severe case of metritis, but the 4 still is metritis.
So what do you do? So now I've identified that I've got a score 4. What is the best? Because that's the other thing. Do we put something in the uterus? Do we just treat them systemically? What is at least the latest recommendations for treating those cows?
That's a good question, James. And I don't think that we have still the answer. I can tell you sort of like what is my opinion on this area and what our studies have shown. But the latest study that we did that I was mentioning, we look into comparing an antibiotic-free treatment where we did infusions of 50% dextrose solution 3 days in a row upon diagnosis of the disease. That was 7 ± 3 days in milk. We diagnosed the disease, treatment there the next day and the day after, so 3 days in a row with 1 liter of dextrose. We compare that to a systemic antibiotic conventional treatment, right? The one that you will see by label, the 2 medications that has Septiafur by different companies. So we utilize one of those and we follow the label, right? And we split then into the two main disease scores, like 4 and 5. And one thing that we found is that for score 4, both treatment strategies were good at improving milk production to the level of normal cows, right? So we treat those animals, and by about 7 days to 10 days after we treat them, the milk production of those animals went back to normal with both treatment. Now with score 5, it was really interesting to see that only the systemic antibiotic was able to bring up the milk production to the level of normal, while the dextrose cows were delayed even up to 150 days in milk. So it was like a long-term a negative effect on treating those animals with dextrose. Now, a big pitfall of this study was that we did not have a non-treated metritis group, and that would have been like great to have, because you will see how much of these effects that we're seeing are due to self-cure, right? Because we don't know how many of our population that we actually treated, they were actually just going to self-cure. And, through animal welfare concerns and IACUC approval and stuff like that, it's a little more is a little trickier and harder to get that type of group. So we did include it just based on that, the ethical component of the research. But it would have been great to have that group, because then you say, okay, this is a healthy animal, which we have those. We have the healthy animals at the same days in milk, and that was our like control group, like negative control group. Then we'll have the untreated metritis cows, and then the 2 treatments metritis cows. But we're missing that untreated metritis group, and it's one of the biggest pitfall of the study.
One of the things you discussed in the webinar was that metritis cows have pain. Mm-hmm. So if they have pain, do we mitigate the pain?
Yeah, that's a good question, Fred. And it's a question that I wanted to answer long ago. It's just like, how you have all these ideas and some of them can become priority sometimes due to the funds that you can get and whatnot. But on those lines, there was a really nice study just published a couple of months ago by colleagues in Wealth, Dr. LeBlanc, that actually it did exactly that. But it was an interesting approach, because my approach, what I would have done, I would have been treating the cows with antibiotics and with an anti-inflammatory. But Dr. LeBlanc, what he did, he treated, or his group treated the cows only with an anti-inflammatory, and they use ketoprofen, right? It's one of these NSAID, non-steroid anti-inflammatory drugs, sort of the same family of the flunixin and aspirin and meloxicam, right? So it was interesting approach, and they actually got really positive effect on that treatment. So they actually have, even when it comes to inflammatory markers that they assess, were lower in the groups treated with this anti-inflammatory compared to the antibiotic, and then cure rates and other parameters were similar to the other treatment. So there are definitely good results coming on those approach, and it might be multifactorial reasons that they're seeing this, but definitely by managing that exacerbate inflammation. Right, that sometimes occurs in these infectious diseases, they have a positive outcome after. One thing to mention that is that we have to be careful about what medication to utilize, because with any inflammatory condition, we want to prevent exacerbating inflammation, but we don't want to inhibit inflammation, because inflammation has a physiological, biological reason to happen, right? Is to kill the bacteria and sort of come back to homeostasis, right? So we have to be careful about the potency of the anti-inflammatory medications that can be used. And I'm just gonna do a quick example on that happened in a study that was done also by colleagues at Guelph University, Dr. Duffield Labs, where they treat cows at calving with flunixin, right? Flunixin meglobin, and that's one of the strongest anti-inflammatory medications we have for cattle these days, right? And what they saw a lot of negative effects, such as retained placenta, increase of metritis, low milk production, postpartum fever. Even when they did it at the beginning, the onset of stage 2 of labor, they saw a higher stillbirth rate. So the calf was just basically dying right during calving. And my hypothesis of those results is that it was too strong. They were blocking all the inflammation happening, and those inflammatory process, they have a biological reason, which is the whole parturition process, right? Starting parturition, expelling the placenta, all of those processes, they need inflammation.
Well, that's interesting, isn't it? I mean, I just think sometimes our bodies work pretty amazing, and there's a reason we developed with some normal inflammation, right? So it's kind of interesting. Going back to your study where they used, I think it was flunixin they used. Do you know what score they were? Did they treat those cows with scores 3 and 4 or 4 and 5 that got better? Or were they treating them with 3? Do you know?
Yeah, I believe it was ketoprofen. It's the same family. It's a milder anti-inflammatory for metritis, right, James? You're asking?
Yeah.
Yeah, my understanding, if I recall properly, they just use the standard definition with the red, brownish, watery, and smelly. Or very smell discharge, which is even better because it will be the more severe score of metritis. And if you're having those such a good result in that severe cases, imagine in the milder cases, probably it's even better. So I think it's really promising data that's coming out of these colleagues. Now we have to look into medication that we can actually use in the States, right? And there's this small number of them that we can use, but they have not been tested. And I think that's an area that we could do more research to see if they had the same effect. It's interesting how it works with anti-inflammatory, because even the anti-inflammatories from the same family of drugs, they are so varied, the effects on the cows. And there are so many different factors that can affect that, like the route of administration, the dose, the frequency, and so on. And especially in cows, right? Because even if you give something orally with the rumen and all the digestive system of the cow, there's more room for different metabolism of these medications, although they're from the same family. So we cannot assume that because that's what we have seen on at Calvin, on all the studies that have been done to decrease or modulate inflammation around Calvin. There are so many medications from the same family that work so differently. Some of them, they have no effect, others have negative effect, other ones that actually work well, although they're within the same family of drugs. So definitely have to do more research there.
One of the conversations that we had at the webinar was why the prepartum anti-inflammatory therapy was only found to be helpful in the overconditioned cows. Quirky thing. What's the thought on that?
Yeah, that's a good question, Fred. And I remember that conversation we have. And I mean, one thing that we're doing in the lab now, sort of on top of the metritis research, is like trying to define high risk animals for exacerbating inflammation, therefore susceptibility to disease among those metritis and others, right? Ketosis, hypocalcemia, and so on. And one thing we're seeing is that those overconditioned cows, they actually have a high inflammation pattern before calving. So we are sort of starting to weekly sample animals with different features, and we're categorizing those animals based on those features, such as animals that were dry off with a high milk production, animals that were dry off with high somatosal counts, animals that dry off were lean, animals that were overconditioned at dry off. So all these different factors that might or might not be related to a high risk of having high inflammation in the transition period. And one thing that we found in these overconditioned cows, that they have higher inflammation before calving. And that is one hypothesis, that maybe because that study, Fred, perhaps for the audience that haven't watched the webinar yet, in that study, we found that if we treat the cows, overconditioned cows, with an anti-inflammatory, in that study we use aspirin, before calving, 14 days before expected calving date, we found a decrease on the incidence of diseases in the first 60 days in milk. And it was about 20% decrease. So it was a fairly large decrease on the number of animals that actually got sick in the first 60 days in milk. And it might be related to that, to help cows to maintain a healthy inflammation. I like to call it that way. Healthy inflammation instead of unhealthy or exacerbating inflammation.
Dr. Barragan, you've shared a lot of really neat information, and hopefully we've stirred some interest to have our listeners go back and listen to the webinar. Can you give us a take-home message that you want producers to remember?
Yeah, I mean, the take-home message would be that I think that these days we have to step out a little more and watch a little more. Sort of like monitor from far, right? And we talk a little bit about this in the webinar. I believe that we talk about these new technologies that are out there that help us tracking the cow behavior and sort of telling us which animal has or have not to be checked. But there are other ways that can be done, right? Even when I first started working as a veterinarian, we used to just wait as the cows came to the parlor or leave the parlor. I will just sit there and watch the cows, and then just by looking at the animals, you can tell when an animal is about to, especially with enough experience, is about to or is actually sick, right? And then you get to the list, and then you check those specific animals. So I think that a take-home message would be we have to be a little more hands off these days, because sometimes we just introduce more stressors than the good that we do by checking the animals. And also the other take-home message would be, regardless of the disease definition you use, because I don't want to say that what our study show is, is the way to go. It's just another study, and it's just actually might add more controversy to the old controversies already out there. But regardless of what definition you utilize, just make sure it's well defined across the whole farm, across all the employees in the farm, and you have a well-developed protocol that define that disease, and that tell how to diagnose that disease and what to do with those disease animals. Because regardless of what you prefer or what you choose to define the condition, it is really important that everybody in the farm is in the same page. I'm just gonna leave it there, Fred.
Very good. Jim, any final comments?
No, I think that was good. I think we're learning. It's amazing. We do all this research and we still continue to learn. So I think, well, as you mentioned, maybe in 5 years we'll have it, at least metritis kind of figured out.
Yeah, a good professor of mine, James, used to say that a good research study is the one that creates more questions than answers.
Yeah,
and I am a
that's
big
true.
believer of that.
Yeah, that's true.
Dr. Barragan, thank you again for being part of our I-29 Moo University podcast. We invite our listeners to go to the I-29 website. They'll be able to hear the podcast again, as well as get to the webinar and have an opportunity to listen to that. Again, thank you very much. And we invite everybody to come back in a couple of weeks and listen to our next I-29 Dairy podcast.
Thanks
Thank
again,
you.
Fred and James.
We'd like to thank our annual sponsors, including our gold sponsor, Iowa Corn Growers Association. Please visit their website at iowacorn.org. We'd also like to thank our silver sponsors, Pioneer, Connor Agri-Service, Diamond V, and Central Vet Clinic. I-29 Moo University is an equal opportunity educator. For the full discrimination statement, visit extension.iastate.edu/diversity/ext.